Daily Show with CJ Nasello on RiverBender.com.
Hello, it's me.
1024, welcome back to this 5th day of March. In the studio, Marla Nelson, OSF Healthcare. How's life treating you again? You're becoming a regular on this show.
Yes.
Welcome in. Welcome in. That chair's almost yours now. You know?
Yeah, I'm expecting my name to be put.
We just talked about the Lunch and Learn. Mm-hmm. How'd that go?
It went really well.
And now another opportunity to come together as a group.
Yes.
Really unique. So this friends and family group is on Tuesdays, 5 to 6 at the OSF St. Anthony's Healthcare Center Psychological Services Department, correct?
Yes.
Where's that at?
So we're on the 3rd floor of the hospital. So if you come in the main entrance, and you would be directed to the 3rd floor, and we're right there. We have like almost kind of a part of a wing, I guess you could say, and we have a really beautiful group room.
Really unique.
Yeah.
Well, now take me through this friends and family group. Who is it for?
So it is for friends and family who have a loved one who's struggling with a substance use disorder. In
this group, is it going to be a way for others to maybe collaborate, talk about their shared experiences, and maybe get some insight, some knowledge that way?
Yeah, it really is. It is it's a therapeutic group, So there are other groups like Al-Anon and such. So you're going to have that support, and be able to have people going through that same situation. Because, people who are struggling with a substance use disorder, they live with a lot of shame. Yeah. And truthfully, so do the families, Yeah. Somebody asks you, hey, how's Johnny doing? And
you know what that question really is. You're so right about that. And, sometimes, too, I think that there's a boundary issue that comes into play because, I am not a parent and, hopefully one day I will be. But if my kid's going through something and, every once in a while they go, hey, Dad, I need $100 because I got to pay my electric bill. But we know that $100 isn't going to an electric bill. And it's like, if I say no, who is he or she going to go to next? Is it what happens then? And there's so much guilt if you don't, that you can put on yourself in that situation. And I'm sure that you encounter that, in a regular occurrence with folks.
Yeah, I really do. And I think that's probably one of the biggest struggles, when you have somebody who's, really struggling with a substance use disorder is, where are those boundaries, know? And, a lot of us, have seen on TV some of the intervention shows, and I'm not anti-intervention, but, just the thought of thinking, wow, to cut somebody off totally. But really kind of having a group where, you could talk about, boundaries with love. There is a way to do that. And also just getting some education, because there's some psychoeducation that goes on in this group
Well,
too.
that's kind of why I'm so glad that Randy booked this conversation today, because this is a big show for us. In a couple of minutes, we're going to be welcoming back on Centerstone and talking a little bit about other programs too. And just the more that we can talk about all of these opportunities that are around, it's not a one, size fits all problem here, an equation. There's so many of these that even if one person gets some knowledge out of this and they gain some better understanding and they can move forward and, see life outside of addiction or their loved ones' lives outside of addiction, that's the win.
Yeah, it really is. And I think with the families that I've worked with individually, the biggest question is, what can I do to help?
Right.
And
am I actually helping?
Yeah. Or am I hurting?
Exactly.
Am I, we hear the term enabling, and that's a real thing.
Big time.
But at the same time, how can I navigate this and love my child or my husband or my, sister,
right.
Whoever it is, do more help than harm. And there are a lot of ways to do that. So,
and what if it's okay? What are some of the things that are going to be? Has the group started?
The group has started. So yes, the thing is, if you're not already a patient at OSF Behavioral Health, we will have to do an intake, and that's okay.
That's fine.
We could do that. Get you in. Some people like to maybe bring a whole family in, or, a couple coming in. And of course, everyone's welcome. So a lot of things that we'll be talking about are, really, I want to educate people on addiction, because a lot of us who don't struggle with addiction might say, why are they, even if it's, say, alcoholism or alcohol use disorder is the proper term. Why can't they drink like me? Well, you're going to get some of those questions answered in this group. Again, talking about those boundaries. And then really, what can you do outside of that? Because it can be very consuming whenever you're worried about your loved one who's struggling with any form of addiction. So how do you take care of yourself, in the midst of all this? Well,
and that's because the caregiver goes through as much, if not more stress sometimes than the individual that's going through the battle. Yeah,
you're right. It really is. And like I said, that shame, you're just kind of wearing this cloak of shame because everybody, we all want to talk about our kids or our mates or whatever in a positive light. And it's, painful, I think, sometimes when people ask, what do you say? Do you lie? Do you avoid?
Well, then I'm sure it goes back, and especially because I haven't had a conversation with a parent about this, but it's like, where did we fail?
Yeah, you're right. There is a lot of, especially for parents,
right,
kind of take that on.
And this is why I think this is so important, and that's why I wanted to have you guys on today on the same day, because it's the more that we can have an extended conversation about this and see how various organizations are doing this, it's so important. And now, how long does it take to get intake done if someone's ready to make that decision today?
Well, some of us, it just really depends. So for me, I could probably get somebody, in an intake. Well, I have an opening today. 2 o'clock. I do. I just got an opening, So yeah, if you're out there and you want to do this today, give us a call. But I don't know if it can happen that quick. But, we'll try to get you in as soon as possible. I know right now I'm scheduled a couple weeks out, but we all kind of work together and we'll do whatever we can to try to get you in.
And how long do this installment, this group, how long will it run for?
Well, I think until nobody wants it anymore. Out. Yeah.
I like it.
And it's an open group, so anyone can join at any time. We don't have any, like
milestone,
12 weeks and then we get a whole new group. So, people can flow in and out of the group too, because maybe, they've got some good tools or coping mechanisms and they feel better and they step away from the group, they can come back.
This is so cool.
Yeah.
What would you want the public to take away from this the most today?
Well, I think I would like friends and families to know that you're not alone.
Yeah.
There are people out there that are going through the same thing as you, and we understand as therapists, and I would love to see you at this group.
And, if you're just tuning in, from 5 to 6 p.m. on Tuesdays, the Friends and Families Group at OSF St. Anthony's Healthcare Center in their Psychological Services Department on the 3rd floor, a really great opportunity for education about addiction, loving boundaries, self-care, and all these great topics. And, Marla, as always, we'll link everything in a write-up on RiverBender.com. But I wanted to make sure that we, had some time to discuss this.
Yeah.
And what's the best way to gain more information on these groups and be a part of them?
Well, you can call our office at 618-474-6240. Usually you could self-refer. I know there are some insurances that require a referral. A lot of them don't, but you can give us a call again at 618-474-6240.
On Tuesdays from 5 to 6, the Friends and Family Group at OSF St. Anthony's Healthcare Center, the Psychological Services Department. Marla, always great having you on the show.
Thanks for having me.
I know we didn't get 20 minutes today, but 10 and 11 to discuss this is still as important, and thank you so much for that.
Oh, thank you.
We'll take a quick break at 10:33, and we'll come back with more Daily Show right after this on the Heart of the 618.